Jack Pattie and Holly Brady, and we switch gears here and bring you the founder and president of a national organization called Health Watch USA. He is a retired physician, Dr. Kevin Cavanaugh. Good morning, sir.
Oh, good morning, sir.
I look forward to having you on 3 days a week. We have you on a brief basis on Monday and Wednesday, but we get to have you for a half an hour today, and I always look forward to it. And Holly, you had a question right off the top.
I do, if you don't care to just jump right in, Dr. Cavanaugh.
No problem.
I've been paying very close attention to Sweden, and there's two camps. There's the camp that says they didn't do enough, and now they're paying the price, and there's the camp that says that they're taking a few careful steps, but they're developing herd immunity and actually doing the sort of the better thing in the long term. Where do you stand on that, sir?
Well, that's a very good example. In fact, if you look at Sweden versus the country right next door, which is Finland, you can see the difference between the two. They both have a universal type of a healthcare system. Finland, however, has been very strict with their social distancing and closing down. Sweden has not. Now, they still have some things. You have to either wear a mask, or they're suggested that you wear a mask. They don't want a lot of travel within the country. You can't gather groups of larger than 50. So it's not true that they haven't done some social distancing. But the death rates in Sweden are over twice that of Finland. And that's what I think you're going to be seeing, is that if you don't do the social distancing, we're going to see a huge influx of deaths. The other thing that Sweden has is that they had a healthcare system that's a little bit more prepared than ours. One of our problems is that of getting the healthcare system overrun. And if you do that and people can't get supportive care such as oxygen, then the death rate will skyrocket. And as I stated before, as far as I can calculate, we've got a death rate when you adjust for the biases in data. I mean, we're not using all young people from aircraft carriers. When you adjust for that, you've got a death rate of probably 1% or a little higher, which is huge for an infectious virus, because then that will translate to society of being an enormous figure. So I think what the governor is doing is quite good. What I should add, and I think that this is very important, is that you do have two different philosophies. But doing it piecemeal, where one part of the country does one thing or one county does one thing, and in another area we do another, that's going to, I think, assure that neither's going to work. Economy doesn't respect boundaries. You have to have business going in all areas. Likewise, the virus doesn't respect boundaries. So we may end up with the worst of both worlds. And that's why we really need to have strong national leadership and guidance.
That answer your question?
Well, it does. And unfortunately, it just sounds like there's really no good answer until we get a whole lot of 2020 hindsight on all this to look back and see what it was that we all did that really worked, or, what didn't work, unfortunately.
Well, this is paving new paths, and I think you're going to find that any option isn't good. And that's what people need to kind of realize. We're going to go through an ordeal because this has gotten released and spread in our society. And whatever path you choose is going to have significant downsides. And that's one of the reasons why we need to rally around and support our leadership and not be divisive. We're all in this together. This virus doesn't care if you're Republican, if you're Democrat, if you're rich, or if you're poor. It will come after you. And I know right now, unfortunately, people who are having to work and are on the low-end jobs and are lower socioeconomic scale are getting the blunt of this epidemic. And that is unfortunate. But we really do need to make sure that our frontline workers have proper protective equipment. And that is one of the big issues we have right now. Amazon, for example, their workers, what I understand today, are starting to strike. And just for the day, but nevertheless, it is a warning sign that if we want people to work and we want to open up our economy, we need to get prepared. We need to get them proper protections. And that includes everybody wearing masks. If you're a patron and you go into a store, it is respecting those employees who are putting their lives on the line to keep that business open. It is respecting them to wear a mask. Because remember, you can be an asymptomatic carrier and not even know it. You can have between 25 to 50% of the people being asymptomatic carriers. And that mask, although it may not help you from getting infected, you're not wearing full hazmat gear with goggles, but if you're an asymptomatic carrier, it will help other people from becoming infected by you. So that is very, very important.
Two medications, one that could be protection ahead of getting the virus, and another one that treats the symptoms of the virus were being discussed yesterday. Are you familiar with those two medications?
You mean Remdesivir? Yes.
Yes, sir.
Yes, I am. What was the other one that you had on the preventing? Is that the hydroxychloroquine that people are saying?
Yeah.
Well, that one, I don't think there's much data to support it. In fact, one of the big things that I think of closing down the economy has bought us time to get our healthcare system prepared and to figure out the hydroxychloroquine probably isn't going to work, maybe even more of a poison, and that Remdesivir has now coming online, which can give some help. So just that, you can look back and say, we've gained some ground. The other thing that's happening, which is very, very positive, are the vaccines. They are doing things that I just can't imagine to bring these on fast. This initial estimate of 1.5 to 2 years may be way too long, because what they're doing is they're starting to manufacture some of these hopeful vaccines before they even know if they work. So if they do work, they'll have enough doses. Of course, that means there's a lot of money that was invested that is just going to be a gamble that you lose. But compared to the money that we're losing with the slowdown of the economy, it's minuscule. I think that was very good. The other thing, which is very surprising, is that normally when you have a vaccine, you try it out by giving it to a group that gets the vaccine, a group that doesn't get the vaccine. You go out and let them mingle in the population for 6 months to a year, and then you see how the two different groups do. They are now talking and considering, and they have, what I understand, thousands of people have volunteered of doing challenge trials, where you give a person a vaccine and then you actually give them COVID-19 and see if they're resistant. That's kind of what you do on rhesus monkeys. That's never been done because of ethics on people before, and this is now a big discussion with the universities and the people that are on these ethical committees, along with a number of people that volunteer that just want to get this vaccine out there to save lives. I'm kind of following that issue very closely. So I suspect we may well have a vaccine coming along very, very quickly.
And I did read or heard that the company that's making it, I don't know if it's SmithKleiner, who it was, is going to charge their cost on it at first, if they can get it put out quickly.
Yes, I think that will be true. I think that is very good for the company to do that. Unfortunately, with the coronavirus, I would suspect it would be more like a flu vaccine, where you're going to have to probably get a booster every year, because you would expect the immunity from just the infection to be 1 to 2 years out. That, by the way, is one of the biggest problems with herd immunity. Not only does an enormous percentage of the population have to become infected, but by the time that happens, you're not sure if the initial people can't become infected again. So the vaccine here is key. And I think having them charging cost on the front end to get it out and get this epidemic under control would be absolutely fantastic.
Yeah. Here's a text on our Auto Tech Service text line, then we'll take a break. It says, I would like the doctor to comment on the Stanford study that has found in California, one county which reported 1,000 cases actually has 60,000 people that were infected and recovered, and that New York has had approximately 2.7 million people infected and recovered. Do you want to think about the Stanford study?
I've looked at both of those. The California appears to be an outlier. One of the problems that they've had, and this came about after the Stanford study, is that these vaccine tests are not that accurate. And they're just in the infancy of development. I mean, normally it's developed 4 to 5 to 6 months, sometimes a year. These were cranked out in the matter of weeks. The New York data I've looked at most extensively. And what that was is projections from the number of tests, antibody tests, the number that were positive. Well, you have to realize, number one is you're primarily testing people that have symptoms or have been exposed, so that percentage is going to be much higher than what would be expected. So in other words, that data is going to be biased. Also, the number of deaths has been grossly underestimated. Not everybody's being counted, especially if you die at home or if you die in a nursing home. Now, New York has adjusted for that some, but we've seen additional problems in, for example, Florida, where you've got deaths of people who are snowbirds that aren't being counted in any state, and the state deaths don't add up with the coroner/medical examiner's death tolls. And right now, they've been clamped down by the state from even releasing their data. So the data has a problem, and it's somewhat underestimated. So when you look at all of that, you come out with about a 1% or greater death rate for New York.
And Jack Pattie and Dr. Kevin Cavanaugh on the line. We jumped you, Dr. Cavanaugh, and just went right into some stuff we had questions about. What are you thinking about this morning that we need to know?
The last question was good to go over and what the answer was, because it's extremely complicated, and that's the take-home message. The data is not simple, and it's the old adage of lies, damn lies, and statistics. All of this data has biases in it that you have to adjust for. You just can't take out a group and say the group of people who are under 25 or under 10 or in grade school or aircraft carriers and project it to the population, say everything's fine. And likewise, you can do the opposite. So, and as I said before, I've got spreadsheets that have 500 blocks of data. And if you look at the biases in the data, you can pick out figures and make any argument you want. So people have got to be very wary of that when you hear political talking points, because there's a lot of side agendas on both sides of the aisle that you need to ignore and just look at the epidemic. I mean, look at the stories and the pictures coming out of New York. And remember, this virus doesn't respect boundaries. That is why we want to avoid that and follow what our governor's advice is. He's been extremely good on his advice. The only thing I would like to see augmented is people wearing masks, especially the food handlers, preparers, and the patrons. Because remember, there is asymptomatic spread, and that's very important.
Here's another text from our Auto Tech Service text line. How can we know when it's okay to visit healthy family in state, but in another town? It's not like it's suddenly going to be safe, right?
Well, that's correct, but I think it's going to be safer when people start wearing masks and start doing social distancing. They're not all gathering in a group outside of Kroger until the store opens. When all of that calms down, we don't have gatherings of any types, and this is including, I don't care whether it's at a farmer's market or whether it's at a church. When people start observing that, and we can start to see our rates maybe go down a little bit to go and visit. It will also depend upon what the habits are of the family you're visiting. I mean, if they're out going all over the place, I wouldn't visit them. If they've spent 2 weeks social distancing, then that's going to be a safer situation. But everybody's going to have to weigh those risks versus benefits themselves, because every situation is going to be different. And obviously, people are starting to get isolation fatigue, and that's a real thing. But I do believe that we may get a hiatus, or at least a calming down of the epidemic with the warm, humid weather that will be coming, and then hopefully it will be a little bit safer then also. So I think right now I would still follow the guidance of the governor, and at the point where it looks like it's not going to get any better or it's as safe as it's going to get, everybody's following good hygiene and good social distancing. At that point, I would then consider maybe going and visiting your family. And you may still want to do that 6 feet apart, especially if they're elderly and at high risk. But right now, I wouldn't. I would follow the governor's advice.
Well, they opened up beaches in California, and they showed on the news last night. It looked like Labor Day weekend. I mean, there was not a square inch that wasn't occupied. And that's what scares me the most. People are going to go back to the way it was.
Well, and that's what's happened with other epidemics. I mean, that's kind of human nature. That's why other epidemics have additional waves, or the other wave may peak. Hopefully with the beach, because of the warm, humid weather, that maybe the spread won't be as much. But if you're up close, it's going to spread. And this is a highly infectious virus, which is why the herd immunity theory doesn't really work. This is kind of like polio. You didn't get herd immunity with polio. It just kept coming back till you got a vaccine. So on this,
Thank you, sir. We're going to talk to you on Monday. Have a great weekend. Thank you, Holly. We'll be
Sir?
back Monday morning at 6, 5 Central.